what blood pressure is actually too low. What is low blood pressure, or hypotension is the word we give to it. I'm just going to come right out and tell you that many, and I would say most sources say less than 90/60 is considered to be low blood pressure or hypotension. Now, what I'm also going to tell you though is that there's a bit of a caveat, because there are some patients who, if their blood pressure is even higher than that, they still feel symptoms of low blood pressure, which I'm going to get into in a moment. So you know how I'm often saying it kind of depends, everyone's a little different. Well, this is the same here, but pretty much less than 90/60 are considering definitively low blood pressure. But some people feel the signs and symptoms of low blood pressure when their pressure is even higher than 90/60. Guys, I'm Dr. Jen Caudle. It's good to see you, okay? All right, now let's go over the symptoms of low blood pressure, and then I'm going to tell you what can cause it, okay? Symptoms of low blood pressure really can make you feel kind of crappy. Some people feel weak. They feel kind of like, like low energy, lethargic, like, oh gosh, they feel, just out of it. Also feeling dizzy can be a symptom, feeling lightheaded as well. Also, this is a symptom that's a little bit more severe, but can happen, with severe, hypotension, or in some patients, confusion. Some people get nauseous, or they sort of have stomach issues. Some people get headaches, and low blood pressure for some people can lead to fainting, right? It can lead to a loss of consciousness. Also, things like blurred vision, like you feel like you're and again, just think about that feeling when you're like, oh my gosh, I just don't feel well, right? And I'm grabbing on to like my couch side. Yeah, I know you can't see it. And I'm grabbing on. Like most of us have probably felt like this at some point, where you feel like, oh my God, I just need to sit down. Oftentimes, the things that you're feeling in that moment can be associated with the feelings of low blood pressure, amongst others, right? So lightheadedness, dizzy, feeling like you're going to pass out, feeling faint, feeling fatigue, things like this. But also nausea can come with it, headache, as I mentioned, blurred vision. Sometimes people get palpitations, okay? Palpitations is basically when your heart is beating too fast, or skips a beat, or beats irregularly, things like that. It's a combination of a number of things, but sometimes when we have low blood pressure, sometimes our heart rate can speed up. Sometimes we can also feel palpitations. So keep that in mind. Now, let's talk a little bit about what can cause low blood pressure. All right, because I have plenty of videos on high blood pressure. I will link them here because I think it's important. But I realized, I was like, gosh, I never talk about low blood pressure. So here we go. Things that can cause low blood pressure. There are some very obvious things in the medical world that cause low blood pressure, like a massive loss of blood. Okay, we think of trauma, accidents, things like that. You lose blood, you're losing that sort of pressure, that blood pressure. Your blood pressure will go down. So loss of blood and things like that. But there are less severe sort of traumatic things that can cause it. Dehydration, okay? Being dehydrated can cause your blood pressure to be on the low side, all right? Oh, and by the way, let me also say that some people, there's no reason for low blood pressure. They just live that way, meaning their blood pressure is always on the lower side. And some people have that, and it may not be a problem. To be honest with you, for years, my blood pressure was like, I don't know, 100/70, sometimes even 90/60, what would be considered low blood pressure for other people. And that was just what my blood pressure was. It's now a little bit higher, but that can happen with some people. Dehydration can do it. Certain medications, of course. And not just blood pressure medications, which is like the obvious things that will lower your blood pressure, but there are other types of medications that can lower your blood pressure, okay? So keep that in mind. Heart problems, people who have a low heart rate or have heart valve problems or have had a heart attack, it's just a number of heart problems can contribute to, say, a low blood pressure. Thyroid, okay, can do it, and other endocrine problems like hypothyroidism. And also other hormonal problems may do it. A major condition called sepsis, okay, that's sort of in line of like the major blood loss. That is an emergency situation, an ICU situation, but that can cause low blood pressure. Allergic reactions, also an emergency, but can cause low blood pressure. And then there are certain medications that can actually cause lower blood pressure, things like Parkinson's disease and others. So when it comes to low blood pressure, this is what I would say. If it's something you think you've been experiencing, what you got to do do is obviously try to figure out why. And you got to do this with your doctor. You can't do this by yourself because low blood pressure can be an emergency. You don't want to be climbing up this tree by yourself, okay? If you need acute medical care, you get that. Go seek medical care, urgent care, ER, etc. But when it comes to chronically low blood pressure, you got to work with your doctor to see what's going on. Is it other medications you're taking? By the way, don't forget supplements, okay? Supplements and other vitamins. You just never know. It's funny what can interact with what. Is there a combination of medications that you're taking that your doctor needs to change? Sometimes combinations can cause low blood pressure. Is there a change in any underlying medical conditions? Okay. Are you dehydrated? Are you sick with something else that needs to be fixed and thus will fix the low blood pressure? So I hope, guys, that this is helpful. The idea is low blood pressure can be very, very serious. Do not sleep on it. Do not blow it off. If you're watching this video, I know you're not blowing it off, but just understand a number of things can cause it. And yeah, less than 90/60. It's really what we consider low blood pressure for most people, but again, it can be different for everyone. Guys, I'm Dr. Jen, practicing family physician, on-air health expert, and video creator. I do daily videos, okay? Please like and follow my page on Facebook, on YouTube. Please subscribe to my channel, click the little bell for updates. Guys, go to my website, sign up for my free health newsletter at drjencaudle.com. Also, I'm on TikTok, WhatsApp, and all sorts of stuff. Guys, I'm Dr. Jen. I'll see you soon.